In this tutorial, I'm going to show how to properly use the cervical wedge to get correction in the cervical spine, but as well as the thoracic spine. So how we are appropriately using it in our office with neurologically based chiropractic. So first off, when you are beginning to use this, you do not need to use the elastic band over your forehead. We want to get comfortable on it, and until you can do it for 5 minutes straight, I don't think we need to be using the band at all. So first we're going to work on getting the appropriate positioning, and then we can add the band. The band is like adding weights to a barbell. It's going to give you a little bit more tension and a little bit more effect, like the same direction as gravity. So what we're going for here is, first off, many of you, and if you've been recommended to use this, you've lost the curve in your neck, in the cervical spine. Now remember, this banana curve should have a full 35 to 45 degree curve in it. And on x-ray, if we saw that that curve has been lost, we are reconnecting the brain to the muscles. So your muscles are trying to pull that curve back in with every neurological reset and get your head back up on top of your shoulders. The problem is there's a big, thick ligament on the front of your spine called the anterior longitudinal ligament. Like with any other ligament, when the ligament is in a shortened position for an extended period of time, it gets short. So when your head has gone forward and the curve in the neck has been lost, this ligament that runs right here on the front of the spine has gotten short. So what we're trying to do is stretch the ligament so that the effect of your brain telling your muscles to pull the curve is not inhibited. That's the big idea here. Just stretching the ligament on the front of the cervical spine so that that curve can come back in, and your posture, blood flow, nerve flow, everything can get reconnected between your brain and your body. So when you lay on the cervical wedge, what we're going to be looking for is, you can feel that kind of the bump on the bottom of your neck, the top of your shoulder blades. Right about there is where we want the peak of the wedge. Now, if in doubt, put the peak of the wedge a little bit lower on your spine so that you can always scoot down if you need to. So what I mean by that is, when you're laying on your back, you want the peak of the wedge to be right about where that bump is on your spine. Now, your neck will kind of hang over the peak of the wedge here, and the critical part is that your head is not touching this downward slope right here, but also not touching the floor or whatever surface you're laying on. We need that to be the case so that gravity can be pushing down and allowing that stretch of the ligament to be taking place. Now, after you can do this for about 5 minutes, then we'll add the band, and you can progressively tighten it with the adjustment over here. And you're going to work your way up to 20 to 30 minutes, and ideally every day of the week, but your recommendation is probably 20 to 30 minutes, 5 to 7 days a week. Now, one thing there is, if you cannot do that 20 minutes straight or even 5 minutes straight, it's okay to break it up and do it for 1 minute, get off, stretch, go back on and do it for another minute, or 30-second intervals if you have to. And then you can piece those together to the point where you can just do it straight. That will be the goal eventually, but don't give up on it because you can't handle it or it's too uncomfortable for a minute. Some people can hop on it and it's fine from day one. Some people just need a little bit more of a gentle approach to working into it. Eventually, it should feel like a good stretch and it should not be uncomfortable. Now, I'll demonstrate here quick to get on it. But the other thing is, if your head is coming around and it's touching the floor or touching the actual wedge itself, you might need to put something under the wedge. So that's a foam block or folding up like a bath towel, something like that, to put it under the wedge. Or you can just do the wedge off of like a carpeted staircase, if that's the case. It depends on how long your neck is. But the main point is, your head, the back of your head, cannot be touching this downward angle of the wedge or touching the ground, because then it's taking the force of gravity away. We do not want that. So to go and lay on this appropriately, what you'll do is sit like this. You can position the wedge. Like I said, move the wedge so you will lay on it, and it'll be contacting you lower than you might expect, because you can always scoot down. So what I'm going to do is lay back on it right here. If I needed to, I could scoot myself down. But then as I lay my head back, I'm in proper position because my head is not touching the ground and it's not touching the slanted slope of the wedge. So then I would be in this position. Now, after you've been in this position for a while, you're going to want to help yourself off by holding the back of your head and lifting up, and then you can roll to the side. Just do something that's comfortable and safe to help yourself get off, because you will be getting a very good stretch on that ligament. And that's the whole point. So if you follow those parameters and you have yourself in a position that your head is not touching this downward slope and not touching the ground, you'll be in good position. Now, depending on your x-rays, you can consult me and we can figure out if maybe you need a slightly different position, but everybody should be in the position as I described, or possibly even moving this lower. What will happen there is if you have too much curve in the middle of the spine, like a hunchback curve, and you put the wedge lower, well, then you're working on two curves at once. You can actually straighten up this curve, reduce the hunchback curve, and improve the cervical curve all at once. So that might be a positioning that you need to do, but consult with me to make sure we're getting it in the right spot, and I can help you through that. Also, if you'd like to bring your feet up so your feet are flat on the floor, that's okay, or you can have your legs straight, whatever's comfortable for your lower back. Just as long as you are positioning it appropriately, we'll be getting the best results possible. But as always, make sure you ask if you have any questions. We're here to help you, and we want you to get the best results possible doing this cervical wedge and doing it safely.